Every day, millions of people take blood pressure medication that causes dizziness, fatigue, and kidney damage. But for thousands of years, before pills existed, people controlled their blood pressure with plants growing in their gardens. Modern science has now proven these 10 herbs work, and your doctor will never tell you about them. This isn't just about ancient remedies, it's about a paradigm shift backed by rigorous scientific inquiry, questioning conventional narratives and exploring what millennia of human experience, now validated by contemporary research, has to offer. We delve into this crucial, often overlooked, aspect of cardiovascular health. The scale of the problem is staggering. According to the Centers for Disease Control and Prevention, a shocking 1 in 3 adults over the age of 20 in the United States alone contends with high blood pressure, medically termed hypertension. This isn't a niche health concern, it's a pervasive public health crisis affecting a substantial portion of the population, often silently, without immediate symptoms. This widespread prevalence underscores the urgent need for effective, accessible, and potentially less burdensome management strategies beyond the conventional pharmaceutical approach. But the numbers deepen the concern. Despite the availability of numerous pharmaceutical interventions, only 1 in 4 adults diagnosed with high blood pressure actually has their condition under adequate control. This glaring gap between diagnosis and effective management raises critical questions about the current treatment paradigms and their real-world efficacy for the majority. Is it compliance, side effects, or perhaps an incomplete understanding of the body's holistic needs that contribute to this alarming lack of control? The data demands a closer examination. The stakes couldn't be higher. High blood pressure is not merely a risk factor, it is cited as a primary or contributing cause in approximately 670,000 deaths annually within the United States. To put that into perspective, this figure surpasses the annual deaths from many well-publicized diseases. This demonstrates hypertension's profound and often fatal impact on public health, demanding that we explore every avenue, conventional or otherwise, to mitigate its devastating consequences and prevent premature mortality across diverse demographics, prioritizing effective intervention strategies. Into this vast health challenge steps a colossal industry. The global market for hypertension drugs was valued at an astonishing $26.7 billion in 2022, with projections indicating it could swell to $36 billion by 2030. This financial behemoth reflects the widespread reliance on pharmaceutical solutions, yet it also raises questions. With such immense capital invested in medication, is there sufficient incentive or research focus directed towards natural, potentially less profitable, alternatives? The economic landscape undeniably shapes the narrative of healthcare solutions and available treatments. This reliance on pharmaceuticals, while life-saving for many, comes with a documented cost. Patients frequently report a range of adverse effects that can significantly impact their quality of life and adherence to treatment. These aren't minor inconveniences, they include dizziness, a pervasive sense of fatigue, disruptive nausea, painful muscle cramps, and even complex issues like erectile dysfunction. Furthermore, long-term use can, in some cases, contribute to serious organ damage, specifically kidney damage, creating a difficult trade-off for individuals seeking to manage their hypertension. So, what if there was another way? A path illuminated by both ancient wisdom and validated by modern scientific scrutiny, offering potential alternatives or powerful complements to traditional treatments, with a different side effect profile? We are not advocating for the abandonment of established medicine, but rather a comprehensive, informed approach. This investigation seeks to compare the known mechanisms and effects of pharmaceutical interventions with the proven capabilities of specific natural botanical agents, examining the evidence that suggests they can, indeed, lower blood pressure naturally. For millennia, before the advent of synthesized drugs, human societies relied exclusively on the plant kingdom for healing. Indigenous cultures and traditional medicine systems meticulously documented the therapeutic properties of countless herbs, passing down knowledge through generations. Now, contemporary phytotherapy and pharmacology are revisiting these ancient pharmacopoeias, isolating active compounds, and conducting rigorous trials. This represents a paradigm shift, acknowledging that nature's pharmacy, often overlooked by modern conventional medicine, holds keys to managing chronic conditions like hypertension. The evidence is compelling. Our investigation begins with one of the most common kitchen staples, yet a powerful medicinal agent, garlic. Allium sativum, beyond its culinary appeal, contains organosulfur compounds like allicin, which are believed to be responsible for its cardiovascular benefits. The primary mechanism involves stimulating the production of nitric oxide, a critical molecule that signals blood vessels to relax and widen, a process known as vasodilation. This natural relaxation directly reduces the pressure exerted on arterial walls, offering a fundamental approach to blood pressure regulation. The efficacy of garlic isn't anecdotal, it's supported by robust clinical data. A comprehensive meta-analysis, pooling data from 12 separate trials, revealed significant findings. Daily garlic intake, consistently administered over 12 weeks, was observed to reduce systolic blood pressure by an average of 8.4 mm of mercury and diastolic blood pressure by 7.3 mm of mercury in patients diagnosed with hypertension. These reductions are remarkably comparable to the effects often achieved by standard prescription medications, marking garlic as a potent, natural intervention worthy of consideration. However, rigor demands acknowledging potential interactions. While garlic is generally safe, its blood-thinning properties are well documented. This means individuals already taking anticoagulant medications, such as warfarin or aspirin, must exercise caution and consult their physician before incorporating therapeutic doses of garlic. The potential for additive effects could increase the risk of bleeding. This highlights a crucial principle of herbal medicine: natural does not automatically mean without effect or without potential for interaction, demanding informed medical oversight. Next, we turn to hawthorn, Crataegus monogyna, a shrub whose berries, leaves, and flowers have been utilized in European traditional medicine for centuries, specifically for heart conditions. Its mechanisms are multifaceted. Hawthorn is understood to possess vasodilatory properties, helping blood vessels relax and expand. It also improves overall blood flow, strengthens heart muscle contraction, and offers significant antioxidant protection. These combined actions contribute to a reduction in peripheral vascular resistance and improved cardiac efficiency, directly impacting blood pressure. Clinical studies substantiate hawthorn's historical use. One notable study involving 79 patients investigated the effects of hawthorn extract. Participants received 1,200 mg per day over a period of 16 weeks. The results indicated a significant reduction in diastolic blood pressure, decreasing by an average of 6.3 mm of mercury. While its impact on systolic pressure can vary, this consistent reduction in diastolic pressure highlights its specific utility, particularly in cases where diastolic hypertension is a primary concern. The data points to a clear physiological effect. Despite its benefits, hawthorn requires careful consideration due to potential interactions. Its effects on cardiac function mean it may interact with prescription heart medications, including beta blockers, calcium channel blockers, and nitrates. These interactions could either potentiate the effects of the drugs, leading to dangerously low blood pressure or irregular heart rhythms, or interfere with their intended action. Thus, any individual on cardiovascular medication should obtain explicit medical advice before incorporating hawthorn into their regimen, emphasizing safety first. From the heart of the garden to a popular beverage, we examine hibiscus, specifically the roselle variety. Its vibrant crimson flowers are not just aesthetically pleasing but are packed with potent compounds. Research suggests hibiscus acts through multiple pathways to lower blood pressure. It exhibits diuretic effects, encouraging the body to excrete excess fluid, which directly reduces blood volume and, consequently, pressure. Furthermore, it appears to act as a natural ACE inhibitor, a mechanism similar to a class of widely prescribed blood pressure medications, blocking an enzyme that constricts blood vessels. The evidence for hibiscus is compelling. A randomized controlled trial involving 65 prehypertensive and mildly hypertensive adults delivered robust results. Participants who consumed 3 cups of hibiscus tea daily for 6 weeks experienced a significant reduction in systolic blood pressure, averaging 7.2 millimeters of mercury. In stark contrast, the placebo group saw only a modest 1.3 millimeters of mercury reduction. This substantial difference underscores hibiscus's therapeutic potential as a natural, palatable intervention for early-stage and mild hypertension, making a strong case for integrating this botanical into daily routines. Moving to another culinary herb with hidden power, celery seed. Apium graveolens, derived from wild celery, has been used in various traditional medicines. Its blood pressure-lowering effects are attributed to compounds like phthalides, which act as natural diuretics, helping the body expel excess sodium and water. Crucially, celery seed also appears to function like a calcium channel blocker, relaxing the smooth muscles around blood vessels and allowing them to widen. This dual action targets both blood volume and vascular resistance, contributing to a holistic pressure reduction. While more extensive human trials are needed, preliminary research offers compelling insights into celery seed's potential. Animal studies have consistently demonstrated antihypertensive effects. A pilot study involving 30 elderly patients showed significant reductions in both systolic and diastolic blood pressure after supplementation with celery seed extract. Although this specific human data is limited in scope, it supports the traditional use and mechanistic understanding, suggesting a promising avenue for further rigorous investigation into its efficacy in larger, diverse human populations. The early findings are encouraging. As with many powerful botanicals, celery seed comes with important cautions. Its diuretic effects mean it could potentially interact with prescription diuretics, leading to excessive fluid loss and electrolyte imbalances. Furthermore, its purported blood-thinning properties necessitate careful use in individuals taking anticoagulant medications. Pregnant women should also avoid therapeutic doses due to potential uterine stimulation. Always consult a healthcare professional, especially if you have pre-existing conditions or are on other medications, to ensure safe and effective integration of celery seed. Moving to another globally recognized spice, ginger, Zingiber officinale. Beyond its distinctive flavor, ginger has been revered in traditional medicine for its anti-inflammatory and circulatory benefits. Its blood pressure-lowering mechanism is attributed to its ability to act as a natural vasodilator, relaxing blood vessels and improving blood flow. Additionally, ginger's anti-inflammatory properties may reduce chronic inflammation, a known contributor to vascular stiffness and hypertension. This multi-pronged approach helps to optimize cardiovascular function, leading to a measurable reduction in systemic pressure. The scientific community has scrutinized ginger's impact on blood pressure, yielding positive results. A comprehensive review of 9 separate studies concluded that ginger supplementation significantly reduced both systolic and diastolic blood pressure. Researchers observed that more pronounced effects were noted with daily doses exceeding 3 grams. This suggests a dose-dependent relationship, where higher, but still safe, quantities of ginger confer greater therapeutic benefits. The consistency across multiple studies lends strong credence to ginger's role as a natural hypotensive agent, particularly at optimal dosages. From the spices of the East, we find cardamom, Elateria cardamomum, a highly aromatic seed used in South Asian and Middle Eastern cuisines and traditional medicine. Its hypotensive effects are thought to stem from its diuretic properties, aiding the kidneys in expelling excess water and sodium from the body. Furthermore, cardamom is rich in antioxidants, which combat oxidative stress and improve endothelial function. Healthy endothelium, the lining of blood vessels, is crucial for proper vasodilation and maintaining optimal blood pressure, making cardamom a promising natural ally. Clinical research has indeed supported cardamom's traditional use. A study involving 20 individuals newly diagnosed with primary hypertension explored the effects of daily cardamom powder supplementation. Participants consumed 3 grams of cardamom powder every day for 12 weeks. The results were quite remarkable. Average systolic blood pressure dropped by a substantial 20 millimeters of mercury, and diastolic blood pressure decreased by 10 millimeters of mercury. These figures represent a profound reduction, suggesting cardamom could be a powerful tool in managing hypertension, even in newly diagnosed cases. Next, we delve into cinnamon, Cinnamomum verum or Cinnamomum cassia, a ubiquitous spice with an ancient history in medicine. Its blood pressure-lowering potential is multifaceted. Cinnamon is believed to act as a vasodilator, helping blood vessels relax and expand, thereby reducing resistance to blood flow. Furthermore, it plays a role in improving insulin sensitivity, which is crucial because insulin resistance can contribute to hypertension. By mitigating this underlying metabolic factor, cinnamon offers a systemic approach to cardiovascular health and blood pressure regulation. Clinical evidence backs cinnamon's role, particularly in populations with metabolic considerations. A meta-analysis comprising 9 studies observed that daily cinnamon intake significantly reduced systolic blood pressure by an average of 5.39 millimeters of mercury and diastolic blood pressure by 2.6 millimeters of mercury. These effects were most pronounced in individuals with type 2 diabetes and prediabetes, conditions where insulin resistance is often a precursor to hypertension. This highlights cinnamon's potential as a supportive therapy, especially for those managing metabolic syndrome alongside elevated blood pressure. A critical distinction for cinnamon lies in its variety. While Ceylon cinnamon is generally considered safe, large doses of cassia cinnamon, the more common and cheaper variety, contain a compound called coumarin. Excessive coumarin intake can potentially lead to liver toxicity, especially in sensitive individuals or with prolonged high-dose use. This underscores the importance of sourcing quality, specific types of herbs and understanding their distinct biochemical profiles. Moderation and informed choice are paramount when integrating cinnamon therapeutically. Ocimum basilicum, or common basil, is more than just a fragrant culinary herb. Research indicates that basil contains a compound called eugenol, which exhibits promising hypotensive properties. Eugenol acts as a natural calcium channel blocker, a mechanism akin to a class of conventional blood pressure medications. By blocking calcium channels, eugenol helps relax the smooth muscles and blood vessel walls, promoting vasodilation and subsequently reducing blood pressure. This offers an intriguing, natural pathway to arterial relaxation and improved cardiovascular dynamics. While human studies on basil's direct impact on blood pressure are still considered limited, the existing evidence is promising and largely derived from animal models. These studies consistently demonstrate that basil extracts can indeed reduce blood pressure, supporting the mechanistic understanding of eugenol's action. The findings pave the way for future, larger-scale human clinical trials to fully elucidate its efficacy and optimal dosing. For now, it stands as an intriguing natural candidate, with a strong theoretical basis and preliminary data encouraging further investigation into its therapeutic potential. Next, we examine flaxseed, Linum musidatissimum, a powerhouse of nutrition with significant cardiovascular benefits. Its blood pressure-lowering effects are attributed to 3 key components: alpha-linolenic acid, ALA, and omega-3 fatty acid, lignans, which are potent antioxidants, and soluble and insoluble fiber. ALA reduces inflammation and improves arterial elasticity, while lignans act as phytoestrogens and antioxidants. The fiber component contributes to overall gut health and can help manage weight, all factors indirectly supporting healthy blood pressure. This holistic profile makes flaxseed a strong contender. The clinical evidence for flaxseed is particularly compelling. A notable study involving 110 patients suffering from peripheral artery disease, a condition often co-occurring with hypertension, yielded impressive results. Participants consumed 30 grams of whole flaxseed daily for 6 months. This intervention led to an average reduction in systolic blood pressure of 10 mm of mercury and diastolic blood pressure of 7 mm of mercury. These reductions are clinically significant and highlight flaxseed's substantial impact, especially in patient populations already at heightened cardiovascular risk. It's a testament to whole food medicine. Despite its benefits, flaxseed also warrants caution. Its fiber content can potentially slow the absorption of certain oral medications, including blood thinners. Therefore, it's advisable to take flaxseed at a different time of day than other medications, allowing a buffer period. Additionally, its omega-3 content can have mild blood-thinning effects, necessitating a conversation with a physician if you are already on anticoagulant therapy. Proper preparation, typically grinding the seeds, is also important for nutrient absorption and to avoid digestive discomfort. Finally, we explore turmeric, Curcuma longa, the vibrant yellow spice central to Ayurvedic medicine. Its primary active compound, curcumin, is a potent anti-inflammatory and antioxidant. Chronic inflammation and oxidative stress are known contributors to endothelial dysfunction and arterial stiffness, key factors in hypertension. Curcumin helps improve endothelial function, allowing blood vessels to dilate more effectively and maintain their flexibility. By addressing these foundational vascular health issues, turmeric offers a comprehensive approach to managing and potentially lowering blood pressure naturally. Multiple reviews and studies have investigated curcumin's impact on blood pressure. The consensus indicates that curcumin supplementation can significantly lower both systolic and diastolic blood pressure, particularly in individuals with pre-existing conditions such as metabolic syndrome, obesity, or diabetes, where inflammation and endothelial dysfunction are prevalent. While the exact magnitude of reduction can vary depending on dosage and patient population, the consistent findings across diverse studies underscore turmeric's therapeutic potential as a powerful adjunct to a heart-healthy lifestyle, mitigating hypertensive factors. Similar to garlic and flaxseed, turmeric's potent effects necessitate caution, particularly regarding its mild blood-thinning properties. Individuals on anticoagulant medications should consult their healthcare provider before taking high doses of turmeric or curcumin supplements to avoid an increased risk of bleeding. Furthermore, curcumin has low bioavailability on its own, meaning it's poorly absorbed by the body. Often, it's combined with piperine, an extract from black pepper, to enhance absorption. Always opt for reputable, standardized extracts for therapeutic effects. It is critical to contextualize these herbal findings. While powerful, these herbs are not magic bullets, nor are they typically prescribed as standalone treatments for severe hypertension. They are most effective when integrated into a holistic lifestyle approach that includes a balanced diet, regular physical activity, stress management, and adequate sleep. The investigative approach reveals that these natural agents work synergistically with foundational health practices, enhancing the body's innate ability to regulate blood pressure, offering a comprehensive path to wellness that goes beyond symptomatic relief. Leading medical professionals emphasize the nuance required. According to Dr. Elizabeth Baker, a cardiologist at Mayo Clinic, herbal remedies should be seen as complementary, not replacement, for conventional medical treatment, especially for severe hypertension. This expert perspective underscores the importance of a balanced approach. For individuals with severe, uncontrolled hypertension, pharmaceuticals often provide immediate and critical stabilization. Herbs can then play a supportive role, potentially reducing medication dosages over time under strict medical supervision, or enhancing overall cardiovascular resilience. This investigative journey reinforces a paramount message: professional medical guidance is indispensable. Dr. David Chen, a pharmacologist at Stanford Medical, states unequivocally, patients should always consult their doctor before integrating herbs, as interactions with medications and pre-existing conditions are possible. This is not mere bureaucratic advice, it's a vital safeguard. The potency of these herbs means they can alter drug metabolism, enhance or diminish drug effects, and exacerbate certain conditions. An informed dialogue with your physician ensures safety and optimizes therapeutic outcomes. The initial claim, "your doctor will never tell you about them," warrants further scrutiny. Why the apparent silence? Several factors contribute. Medical education traditionally emphasizes pharmacology over phytotherapy. Furthermore, lack of standardized dosing, potential for interactions, and limited large-scale pharmaceutical-style trials can make doctors hesitant. The profit motive in the pharmaceutical industry also plays a role. While individual practitioners may be open, the systemic inertia often prioritizes patentable, chemically synthesized drugs, which translates into less discussion of natural alternatives in the clinic. Our deep dive has revealed a fascinating intersection of ancient knowledge and modern science. The evidence, rigorously examined, demonstrates that these 10 herbs offer scientifically backed approaches to naturally lower blood pressure, often with mechanisms comparable to conventional drugs. This isn't about rejection, but about expanding the toolkit, empowering individuals with informed choices, and reclaiming a degree of autonomy over their health. The journey to optimal blood pressure doesn't have to be solely dependent on a single, often costly, pharmaceutical path. Nature offers potent alternatives. Armed with this knowledge, we encourage you to initiate an informed conversation with your healthcare provider. Discuss the potential of these herbs, their documented efficacy, and their appropriate integration into your personal health plan. Remember, this information is for educational purposes and should not be construed as medical advice. Your health is a complex, individual journey. By exploring all available, evidence-based options, both conventional and natural, you can forge a more comprehensive and potentially more sustainable path towards managing and mastering your blood pressure. Take control today.